everyone, and welcome to the Truth About Women's Hormones Conference. I'm Dr. Morgan Button, and today we're going to dive into the menstrual cycle and hormonal birth control. Now, before you log off, because you might think periods and birth control aren't relevant to your hormone concerns, your daughter, your sister, cousin, friend, coworker who struggles with cycle-related issues or is on hormonal birth control now, their lives could be changed forever by the wisdom of our guest today. It changed mine. Her first book helped me pull me out of a dark place. Sorry, I'm getting a little emotional. Which so much of it was dictated by my hormones in response to birth control, and I can't say enough about her and her writings. So joining us all the way from New Zealand is someone who has been an inspiration to me as a clinician and a writer. We have the brilliant period revolutionary and author of the book titled The Period Repair Manual, Dr. Lara Briden. Dr. Briden, thanks so much for joining us.
Oh, thanks, Morgan. Thanks for having me on such a lovely, heartfelt introduction. I feel a little teary now too.
Well, it's true. Your book made a huge impact when I couldn't really find answers from other professionals. So I did a little Google search of like, how can I fix this pretty much. And I found your book, and it definitely opened my eyes to what I had done wrong to myself without really any kind of indication of risks before I signed up for it. So thank you. I get to tell you to your face. Thank you. That's such an honor. Okay, so let's get started. Tell us a little bit about what you do and your why. Why do you do what you do?
I'll start with my why, because we've just talked about it. It's to help women, as many women as I can, with the information, the knowledge that I've been fortunate enough to receive both from my training and from all my 25 years with patients. All the stories, all the women I've talked to over the last few decades, I now have an opportunity to share that with people who aren't my patients. So that's been very rewarding. My other why is that I'm quite a curious person. So who I am, I'm a naturopathic doctor trained in Canada. So I have a Canadian accent, even though I live in New Zealand. Before I was a naturopathic doctor, I was an evolutionary biologist. I published a paper in a peer-reviewed journal about evolutionary biology and sex differences in foraging behavior. So I kind of have that science angle. I'm very interested in how the body works, how female physiology works. And as we'll discover today, there's a lot about female physiology that's being left out of the current, I'll call it paradigm of contraceptive drugs, which we will hopefully break out of. We're going to have a paradigm shift sometime in the coming decade, I hope, I predict. We'll see. I hope I get to live long enough to see this all overturned, basically, the idea that contraceptive drugs are okay for women. I'd really like to see the day when future generations of women and doctors that look back at these 6 or 7 decades and just think, what the heck were we doing to female physiology?
Yeah, absolutely. So your first book is titled The Period Repair Manual.
Yes. And
the menstrual cycle is still, unfortunately, for whatever reason, like a taboo topic to talk about, but it's really our 5th vital sign. And period problems have become so common that we just kind of wave them off with pain relievers and whatnot until it just becomes too intolerable. Will you talk to us a little bit about what some of the most common period issues are that you see in practice and what they might indicate in your body?
Yeah, I have lots to say about all of that. The first thing, I think one of the problems, excuse me, is that periods and menstruation are often kind of viewed as a separate compartment of health, when in reality they're an expression of health. That's what you mean by a vital sign. Like, that's in my book, I call our period our monthly report card. So they tell the story of what's happening with health. So of course, because lots of different things can go wrong with health, that means lots of different things can go wrong with periods. And so of course, there's going to be lots of different fixes for those problems depending on what the upstream cause is. And I'm talking now about natural menstrual cycles. I mean, we'll have to go into the conversation pretty soon about why pill bleeds are not periods and don't come into this conversation at all. But a natural menstrual cycle is an expression of health. So of course, the things that can go wrong, the menstrual cycle can disappear. It can become irregular. It can become what's called anovulatory, where there's no ovulation. It can become painful or have mood symptoms leading up to it, or too heavy. So those are all things I define in my book, Period Repair Manual. I have, as you know, I have a chapter called What Your Period Should Be Like. That's kind of the starting place. And then there's a chapter of what can go wrong and looking for clues from your body as to what that might mean.
Mm-hmm. And none of that, like everything that you listed, is not normal.
Correct.
Just want to
So
emphasize that it's not normal.
Period pain is not normal.
Right.
It's common, but it's definitely not how it should be. And certainly, we have to mention, I always mention pretty early on, there is a inflammatory disease called endometriosis, which has a big impact on periods. And so, it's a very painful condition. So, and even another kind of red flag, like if your pain is debilitating, it's time to consider whether it might be something like endometriosis, for example.
What led me to your book was the hormonal problems and the mood problems I had when I was younger. And then when I sought medical help for them, I was just given birth control. And without any real education or risks around it, or any investigation into what was at the root of the problem. And I found in practice now that this is the conventional norm, is just handing out birth control like it's candy and just saying that this is okay and safe for you. And I want to know what you would tell a young girl or woman who's having period or hormone related problems before she starts taking the pill or using synthetic hormones.
Well, what I do say in my work, in my book, and to my patients is that the first thing to understand is that contraceptive drugs switch off ovarian function. So they switch off hormones. They induce essentially like a temporary chemical menopause, which I feel is an accurate way to represent that. Like, it sounds extreme, but that's essentially what's happening. And I think once you start to speak about it in those terms, that you're switching off your own hormones, and you actually, by the way, you need those hormones for health. And the contraceptive drugs cannot replace them. They're not as good as those hormones. Once you start to talk about it that way, something shifts in everyone's thinking. Like, certainly I've had lots of patients, have this sort of, okay, the penny just dropped moment. It's like, wow, okay, you've just, they're kind of like instinctively, intuitively know they want their hormones. We know our hormones are beneficial, which they are. And yet we've been given this message that somehow hormones are a liability, so we should just manage them. We should switch them off. And we're given this narrative that that's safe to do, which is not true. Like, the research was never there. They have, there's been some safety studies on the pill, like kind of broad stroke, does the pill cause death kind of stroke? It's like, well, not too often. It doesn't cause death too often, so that's good. But it does impair, for example, bone density, like healthy bones. And we know that for sure. All types of hormonal birth control do that. There's research around that now, finally, 60 years later. And we know that all types of contraceptive drugs have the potential to have quite a negative effect on mood and the brain. And we know that not having, for example, not having natural menstrual cycles, we know now that potentially has a long-term negative effect on overall health outcomes. Like, women who have had 30 years of natural ovulatory menstrual cycles live longer, potentially. There's some research to show that now. And there's different things going on with that. I wouldn't necessarily say that the science is, 100% clear that that's caused by hormonal birth control, but there's starting to be these glimmers of information from the research that our own hormones, estrogen and progesterone, have benefits at the time, that we're making them, and also long-term through our whole life, even after we go through menopause and stop making them. Which makes sense. Like, if you think about it, the statement that testosterone is beneficial for men's general health and not just to make a baby is pretty obvious.
Mhm.
Yet for women, we're locked in this bizarre way of thinking that we don't really need those hormones. They're just for making a baby. You can take these drugs instead. It would be like saying to men, we're going to give you this drug that shuts down your testicular function, and we're going to replace your testosterone with this drug that's actually a little bit more like estrogen. And it probably is going to affect your mood and your muscle mass and things like that. But don't worry, because like millions of other men take it and it's fine. Like that's the message we're in. And it's just crazy. Like, I don't use the word crazy lightly. Like, I just really think this has been a crazy time for women's health. And I hope it's all going to change sometime soon.
I hear so often that, women who have been on hormonal birth control and then they stop taking it, they're like, I shut down a part of myself by taking that. They lose connection to some of their femininity and their deepest intuition because of they're just on synthetic hormones and they're not expressing their own innate hormones, which are so important. Like, we have them for a reason.
They affect the brain in a big way. So it's no surprise that contraceptive drugs that are kind of hormone-like, but actually are not hormones, affect the brain. And I've done a few series on my social media of, coming off the pill stories, all just word for word. Like when I'm with patients, I jot down like their exact phrasing, because it's always word. And some of that made it into my book as well, because it's phrasing that I couldn't have come up with. I'm hearing it from their own mouths. And so one of the stories, that I've shared is she said, I came off the pill, it felt like a curse was lifted. She just suddenly, like the whole world just seemed different, kind of brighter, just a very different place for her. Yeah. And I acknowledge that's not the same for every single woman. I would never suggest that, but there's something happening that, women describe this feeling of coming off hormonal birth control. And behind that, the backstory to that is we've had decades of women being told that's not a thing. Like, we've literally come out of decades of women saying that pill affected my mood, and either just coming off it and saying, well, that affected my mood, I'm not taking these drugs. Like, that's the reality. Or saying to the doctor, that affected my mood, and the doctor saying that's not possible. That's not a thing. That's been what's been happening. I actually shared one time I found this quote from Margaret Atwood from 1972 talking about the way the pill affects mood. And she said something like, it's like having like a film in front of your eyes. You just have this strange sensation in the world. And so that's been around for a while. It's not like this generation of women is the first one to figure out that these drugs don't feel good.
Yeah. Wow, I didn't know that. That's pretty cool. So when I finally decided to stop taking the pill, my doctor just said, when you're finished with your pill pack, just don't start the next one, which ended up wrecking my endocrine system because I didn't know how to support my other systems in the shift from not having hormone function to then trying to realign all my hormones and my gut and liver health and on the side. So my thyroid function declined, my hair fell out and stopped growing. I had ear-to-ear acne. I gained 35 pounds without changing anything in my diet or exercise regimen. And I just was so anxious and depressed. I just felt absolutely horrible. Probably the worst I had ever felt. And I sought care from many different kinds of practitioners to try and help get me out of this. And very few really knew what was going on because the low thyroid was kind of subclinical and wasn't really showing up on lab work, but we finally figured it out. I'm feeling better than ever now. But would you go into what kind of this post-birth control syndrome is and like what is the best way to go off synthetic hormones?
Was that Yasmin?
No, I can't remember the name of it. It was a combo, so it was both the estrogen and progestin.
Yeah, depends what kind of progestin it is, right? So I'm just going to try to explain something that is actually quite important when you're making a plan to come off. and I go into this a little bit in my book, but I've kind of blogged about it more later. But so in terms of coming off, probably the hardest ones, the pill to get off, are the anti-androgen progestins. So drospirenone or cipterone, those are a couple. Cipterone's not used in the States, but that's one that's pretty common in Australia and New Zealand. So those are the part of the pill, the drug that the kind of so-called progestin, it's not progesterone. There's no progesterone in any type of hormonal birth control, but the progestins vary quite a lot. And some are very testosterone-like, and some are a strong anti-testosterone drug. So what you're describing, if you get post-pill acne and oily and weight gain, that's usually from coming off drospirenone, which is an androgen suppressing drug. So you get this surge in androgens, basically. Sometimes during that process, women can be told they have PCOS. I can go different, depending on the clinician and what they decide to call that state. But it's there can be a surge in androgens, which cause weight gain. So what I recommend is and the other factor is, when deciding to come off the pill, is first of all, at what age did you go on? Do you mind doing it? Like, do you want to say what age you were on it, or is that?
Yeah. So I was 15 when I first started, and I was given it for fibrocystic breasts.
Oh, and wow. Oh, really? Yikes. Yeah. Okay. Yeah. I'm just sitting back in my chair. Okay. So using your story, if that's okay, is going on it. So there's a big difference between a young teenager, and I would call 15 still pretty young. It depends what age you actually got your periods. Mm-hmm. In your case, was that like 13 or something like that?
It was.
Oh, okay. So you'd had periods for 4 years. Mm-hmm. Were your periods regular before that? Because that's the other question I ask. Did you have, all right. So you're having regular periods. So already that's actually a good thing. That is probably bodes well for recovery and getting your own cycles back, because basically, just to reiterate, the contraceptive drugs switch off the menstrual cycle. So the robustness or the quality of the menstrual cycle very much depends on how well that's had a chance to become established or to mature. It actually takes 12 years to mature the menstrual cycle, which is why if you give a girl a pill really young, or if she gets her period really close to the onset of her periods, those are the women who might just not get a period back for a while, because, does that make sense? It hasn't had a chance, the menstrual cycle never had a chance to kind of calibrate and get going before it was shut down. Did your periods come back, or did you get periods after stopping the pill?
They stopped for 6 months. So I had one after stopping, and then they stopped for 6 months, and then they reinitiated.
Okay. All right. So, and to keep in mind, it's not like they stopped coming off the pill. Right. Your periods didn't stop.
Right.
No, your periods didn't stop coming off the pill, because pill bleeds are not periods. They're not menstrual cycles. They are in no way. I'm really trying to campaign to change the wording around it, because the other thing that really changes for women is if you talk about them as drug withdrawal bleeds, rather than periods, mm-hmm. that can really help. So if you had been my patient, I would have been sitting there with you and you're planning to come off the pill, I would have said, okay, so how old were you well, first of all, which drug have you been taking? Mm-hmm. What was happening with your real periods before you went on it? And then try to make some predictions about what's going to happen. And then in the case of coming off an anti-androgen drug, like it sounds like you probably did, I would usually try to put in place some strategies to protect skin and try to keep androgens at bay, which is I have a blog post called How to Treat and Prevent Post-Pill Acne, which I use zinc and a dairy-free diet and some other supplements just to kind of buffer that. But there's always going to be the hair loss you mentioned. Mm-hmm. That is hard to avoid, actually, coming off those drugs in particular, because you get the surge in androgens temporarily, and also withdrawal from the synthetic estrogen, which is quite a strong estrogen. You actually the synthetic estrogen is a lot stronger than our own estrogen, and the hair loves estrogen. So the hair just kind of goes into this shock mode of like, what is going on? My estrogen's gone. I've got this testosterone now, and like sheds. But that it usually happens about 3 months after stopping the pill, and it can go on for a while. So I mention this because I've certainly had patients who maybe have tried it once already. They got the post-pill hair loss. They know that's probably coming, and then they retreated back onto the pill in their case, and then they just really don't want to go through that again, and they kind of become trapped on the pill, which is hard. And that's in those cases I would try to be honest and say, I hear you that you don't want to go through post-pill hair loss again. There's almost no way. It's like a baptism by fire. Like you have to go through that. Like you have to go through the drug withdrawal to get on the other side and once your own hormones kick in and your own estrogen and progesterone kicks in, the hair loves that. So it should come back. And of course, yeah, there can be, you mentioned, a thyroid problem flared up post-pill. That would be quite individual. Like that wouldn't be a common scenario. I think that potentially can happen. So it's about, I hope that's sort of helpful. It's about trying to understand what, the underlying tendencies might be based on what your real periods were like, which drug you're coming off, just being then kind of realistic about what's going to happen. So I want to contrast with, we've been talking about what I suspect was an anti-androgen progestin, like drospirenone, but the other ones, like the more common progestins that are in most pills and the hormonal IUD and the implants, those often cause fewer side effects coming off, like fewer withdrawal symptoms coming off. So some women, not to paint a picture that is always like your experience, because some women just stop those testosterone-like drugs and feel great. They're just like, oh, wow, my skin cleared up. Actually, my hair is better. They don't necessarily get those kinds of symptoms. I hope that's clear. And it's hard when it's there is no one size fits all. There really isn't. So, but hopefully what I'm saying now has given people some ideas, and hopefully, obviously in my book, I kind of troubleshoot a lot of different scenarios. I will also say at this point that so not unusual to be told PCOS in this scenario, and that is very much can be a temporary post-pill, what I call in my book, post-pill PCOS, which is different from a woman who maybe, has had PCOS all her life that has, stronger androgen symptoms that are not part of the withdrawal picture, if that helps. Yeah.
Absolutely. So how does all this, like being on the pill for long-term or just taking the pill and coming off of it, affect future fertility?
Well, yeah, I think the research is not there yet. Of course, the main extreme narrative is it doesn't affect fertility. I think that's probably not correct. I've also heard on the other extreme, people saying, oh, I've heard the pill causes, long-term infertility. That's not true either. Tons of women come off hormonal birth control and become pregnant. So I think, again, it's a bit more nuanced. It certainly does affect fertility in some women. Who it would really affect are those girls that were put on it at like 11 or 12 and never had not yet had a chance to mature or establish regular ovulation. It's not like being put on the pill so young will mean they can never ovulate, but it will mean if they are on the pill from like 11 to 35 and come off, they cannot expect to just start ovulating like that. Like, to me, it seems obvious. Like, why would the body do that? Like, it can't do that. So that's one example. There's some other little bit of research suggesting some of those progestins might have a longer term impact on uterine lining even after you stop them, which could affect fertility. I have some other concerns about how exposure to some of those drugs could potentially affect the health of the offspring eventually. There's kind of epigenetic effects, but that's speculation on my part. I have we could talk about that in a future in conversation sometime. But, you know, I think it's not absolute either way. There's some reason for concern, but at the same time, yes, tons of women, you know, use hormonal birth control and go on to have healthy pregnancies. So that's also true.
Okay. So
yeah.
you have a new book coming out.
Yes.
Tell us a little bit about it.
It's called Hormone Repair Manual. It's for women, well, the title says women 40 and above, 40 and older. I would say it's actually for 35 and older, because for some of us, by our late 30s, we're moving into what's called second puberty or perimenopause. So in my existing book, Period Repair Manual, that's in the chapter called What Happens in Our 40s. It's a different, the new challenges come up with our 40s, and that's just a fact. So I decided it needed its own book. It's for 40, 35 plus, like all the way up to, you know, menopause and beyond, you know, sort of into the decade or so after menopause, and then potentially beyond. Although after menopause, you know, that should be quite a stable state hormonally. That should, you know, there's not a lot changing or going on at that point. So yeah, that's my new book. I'm very excited. It's coming out in February. And as passionate as I've been about periods and ovulation and menstruation, I'm equally passionate about perimenopause, because again, I feel like it's a topic that's very misunderstood. We have a lot of fear and stigma and shame around it. And yet now that I'm here, because I'm almost 51, I'm like, oh, it's quite different than I expected. And so I kind of want to throw a lifeline, like, to, you know, to all the women that are, I guess, with me or my age, or a little older, and all the ones that are women that are coming up younger than me, to just say, this is what you know, this is what it's like. This is what you can do. Again, acknowledging the experience. There's a wide range of experiences, and not everyone navigates perimenopause the same way.
Right. When I started learning about perimenopause and menopause, like, I didn't realize that in other cultures, they don't even have words for it. It's almost non-existent. But in the Western cultures, it's this like fearsome stigma, like hush hush, you know, mom's upset, don't talk to her, she's having another hot flash, like kind of situation where we just kind of push that category of women into a cupboard and just try not to look at it.
And so no wonder, no wonder young women fear it, right? Because you think sounds horrible, and you're gonna like, become invisible, and none of that's true. Yeah.
So I'm really looking forward to it coming out. I hope it helps women celebrate the achievement of menopause. Not everybody gets the opportunity to get there. Thank you so much. It's been an absolute pleasure learning from you. I could probably sit here and talk all day, but we're running out of time. So where can we find more about you and what you do and your book?
I'm easy to find. My blog is larabriden.com, where, I'll be honest, I share a lot of the stuff that's also in the book. So there's a lot of just freely available information there, so please dive in. Then all my social media is at Lara Briden, where I do occasionally answer questions on Instagram. That's part of the main place to kind of reach me. And then my books plural, Period Repair Manual for women of all ages, and Hormone Repair Manual for women 35 plus. And that one's out in a couple months. Well, probably by the time this airs, this is out. That's out in February. Yeah.
All right. Well, I'm definitely looking forward to it. Like I said, your first book really helped change my life. So thank you again so much for joining me today.
Thank you.